Here we go. It's part 2 now of the upper extremity muscles. These are muscles that attach to or originate from, insert onto bones of the upper extremity, which means that those bones are going to move. Okay, so we have here a trapezius, and it's being described here in all of its luxuriant origins. Which in this case go all the way from the skull itself, from the occipital bone, all the way down through the nuchal ligament, spinous processes of the cervical region, and then all the thoracic spinous processes all the way down to T12. So C1 to C7, and then T1 to T12. That's the origin. Let's take a look here at what's going on. Look at this very, very long origin. That's quite amazing. In fact, all of these muscles here that we're observing in this picture are muscles of the upper extremity because they are going to move the shoulder one way or another. Okay, in some cases they're using this bone to move this bone. Okay, so we're stabilizing here, for instance, and we're moving either the shoulder or we're moving the humerus. Let's take a look at trapezius then, from the occipital bone all the way down through the nuchal ligament. And as I indicated before, we are runners by design. So when we left the forest as Homo erectus some millions of years ago, we left and we signed a new contract with our new team, the grass team, and we became a runner. So we have arches now, we have Achilles tendons, we have a more erect posture, and we have a nuchal ligament. So we have a lot of features, actually. We'll see vision is a little bit different as well. Okay, so we have, now if we were a cat, and if you ever take a cat lab, you'll discover that this muscle is actually divided into 3 parts, which kind of makes sense if you're going to be as nimble as a cat, because as you can see here, the fascicles up here are doing something virtually the opposite of what the fascicles down here are doing. So this will elevate the shoulder, and we're going to have insertion here in sort of a C-shaped way from the spine of the scapula to the acromion, and then over to the lateral 1/3 of the clavicle. And then so these fascicles will be elevating the shoulder, these will be retracting the shoulder, and down here these will be depressing the shoulder. So we have 3 completely different shoulder movements depending on which portion of the trapezius you're operating. Okay, now we are not learning the deltoid right at this moment, but you can see that the deltoid is picking up where the trapezius is leaving off and coming down this way. So one of the things that we need to see next is, let's see what we do here. This is the trapezius. Let's review this again. Origin, occipital bone, ligamentum nuchae, all the spinous processes from really C1 all the way down to T12. We have a continuous insertion along the acromion, spine of the scapula, lateral 1/3 of the clavicle, and very importantly, oh yes, we're using the accessory nerve here. Do you remember that the accessory nerve, cranial nerve 11, also operated the sternocleidomastoid? So it's going to first penetrate. And remember how it left the skull. Remember 9, 10, and 11, and this is 11. 9, 10, and 11 left through the jugular, traveled down next to the jugular, and then came out a little bit more superficially and penetrated the sternocleidomastoid, passing through the sternocleidomastoid, and then coming to the inside here, and then innervating all the way down on the proximal aspect of all these muscle bellies. Okay, so we have accessory nerve. What are we doing here? We're stabilizing and raising, retracting, rotating the scapula, and ultimately we're putting the shoulder in different positions, as it were. Okay, part, of course, if you're going to lift the shoulder and reach something and then operate something that's at eye level or over your head with your hand, then of course you're going to be using this muscle to stabilize the shoulder at a high level. Okay, then Levator Scapula and Rhomboids are also part of the program here. Levator is this one. Okay, this one on most people, because we're white knuckling and we're, how shall I say, pulling our shoulders up really high because we're having scary episodes. You know, we're the species that normally travels at a walking speed 2 or 3 miles an hour. Top running speed is somewhere in the vicinity of, if you're really sprinting, 15, 16, 17 miles an hour at the best. And so, when you're driving a 3,800-pound vehicle 65 miles an hour, that's completely crazy, actually. And so, of course, if you're not frightened, you're not paying attention. So we have this levator scapula that sort of like pulls our shoulders up, and we try to focus and concentrate on what the heck we're doing. Okay, so then we have the rhomboids here. The rhomboids, and especially this one here, is the rhomboid major, is pretty much shaped like a rhomboid, where we have these two sides that are parallel, two sides here are parallel, but these are non-right angles. And again, with this one is sort of a little helper. Sometimes these are actually connected. In the older cadavers that we get, we actually have adhesions between the rhomboids and the trapezius. When we transect a trapezius like this and we try to reflect it back, these guys are really hanging on to it very strongly. And so getting a little body work, doing some yoga and some Tai Chi and Qigong probably would be a really good idea. Okay, now remember that these muscles right in through here are named for the surfaces in many cases. So the this is the infra down here. This is the supraspinatus. Supraspinatus is attaching here to the supraspinous fossa. The infraspinatus is attaching to the infraspinous fossa. We have teres minor, teres major. Notice that teres major is going inside, teres minor is going on the outside here. These three muscles are actually going to the greater tuberosity here, and they're holding the shoulder in place. What we don't see here coming from the inside, and we'll get to that eventually, is that we have the subscapularis coming from the other side. The deep side here of the scapula is going to the lesser tuberosity, and those four muscles are actually forming the musculocutaneous cuff to hold the shoulder on, just the way you like it. Okay, we'll get to the Latissimus Dorsi soon, but you can see that it's wrapping around. We're going inside the humerus here, and so that means it's going to spin the humerus this way. Okay, so we're spinning we're spinning the humerus this way. Okay, medially. It's going to be a medial rotation. What does that mean in terms of climbing? That means that if this person were to put their hands up here, they could pull down as they're climbing upward. Plus, there would be a medial rotation. Okay, so they could have their hands out here, and their hands could come down this way. A medial rotation. Alrighty then. And that brings us then to the pectoralis major and the deltoid. Pectoralis major and minor are both innervated by pectoralis muscles, and so I'll leave it at that. This is a nice picture because it shows a definition. Here there's actually a vein going through here. This is called the cephalic vein, is running right through this little connective tissue here. There's a space between the pectoralis major and the deltoid. Okay, pectoralis major is coming from these ribs, this area right in through here on the costal cartilage, and then the lateral, or rather the medial 2/3 of the clavicle. Okay, and then it's going to focus. It's going to focus and come across this way, all the way across the intertubercular groove, all the way to the far side, to the greater tuberosity's little ridge right there. Okay, so let's see how they describe it here. Is we're going to go from those three different areas that I described, and it's going to converge to insert on by a short tendon to the intertubercular sulcus, greater tubercle of the humerus. There's already something in the intertubercular sulcus, which is the Latissimus Dorsi. So it's actually going across that to the ridge leading up to the greater tubercle.